You have questions about the hormone progesterone, whether you're on it with questions, you're thinking about taking it, or you're just curious. This is going to be the entire ins and outs answering everything. I'm going to talk about what is it? What is progesterone? Where is it made in the body? What does it do? And then we're going to talk about the different forms you can take because I know progesterone has gotten a lot of press lately. I'm also going to explain progesterone versus progestin and progesterone relative to estrogen. So we're going to cover a lot. Whew, let's dive in. What is it? Progesterone is a hormone, and it is made in the ovaries once you have ovulated. So once you release the egg, that's known as ovulation, the cells, like an irreversible Cinderella, magically turn into something called a corpus luteum or corpus luteum. Those cells produce progesterone. It's only in the second half of the cycle, only after ovulation. So with the first half of your cycle, day 1 is the first day of your period. This is called the follicular phase. That day 1 all the way up until you release the egg, that's the whole follicular phase. Your progesterone is very, 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 very low. Very low. Then you release the egg, and then gradually you make more and more progesterone. It's like a mountain. It gradually goes up, peaks. If you're not pregnant, it drops back down the other side. Your next cycle happens. The mountain peak and fall of progesterone is known as the luteal or luteal phase. Now, what does progesterone do? Well, progesterone got its name because it's progestation. Progesterone helps the uterus be accepting and fluffy and thick for implantation should that be your goal. It helps periods be nice and easy and have less clots. It helps with less cramps. It helps ease PMS. But progesterone is actually helpful all over the body. You have progesterone receptors from the inside of your head down to your tippy toes. Progesterone works everywhere. It's just commonly associated only with the uterus because of its name, progestation and fertility, which is unfortunate. Yes, progesterone does a lot there, and I'm very grateful for it there, but also it works a lot of other places. For example, when progesterone breaks down, one of its breakdown parts can cross into the brain and can be very calming for a lot of people. This is why, as women get older, that they find they don't make as much progesterone and they're not as calm. They maybe don't sleep as well. They feel more anxious. That declining progesterone is part of the picture there. Now, why does it decline with age? Well, it turns out we really only have so many follicles, which are the little cells, like the cell part that contains the egg. And every month we lose a whole bunch, and eventually we don't have them like we used to. And then the cell signaling between our brain down to our ovaries, that communication kind of gets disrupted, messed up, doesn't function well. We have something else called our mitochondria. You're probably familiar with the mitochondria from school, where you learn the mitochondria are our cellular powerhouses, and they are. And we have a lot of mitochondria in our ovaries. And so now there's this concept of the mitochondrial theory of aging, that the ovaries take a harder hit compared to the rest of the body when it comes to aging. In women, of course, those mitochondria do. And so with the declining follicle, the mitochondria in the ovaries taking a harder hit, and the dysfunctional communication between the brain and the ovaries, all of a sudden you just don't make progesterone like you used to. You still might ovulate some months, but the signal is weak, so the production of progesterone is weak. So think of it like a factory. You're a factory that makes widgets. The factory's still there. The lights are on, but the communication to get the widget made isn't there all the time. So some months the factory makes good widgets, which is your progesterone. And other months it doesn't make great widgets. The number count's really low. So this is why it tends to decline with age. Progesterone is usually, of our main hormones, it's usually the hormone to decline first as women go into perimenopause. Estrogen usually declines later, and testosterone, it depends on the woman. Testosterone naturally declines with age, but it doesn't decline at the same rate as estrogen, and it doesn't decline at the same rate in every woman. Some women have slow decline of testosterone, and others have a very rapid decline. But progesterone is usually, of the main ones, to fall first. So if your practitioner said to you, hey, on blood work, your progesterone doesn't look that good, or we should consider progesterone for you, that's probably why. On blood work, progesterone is generally tested in the second half of the cycle. And in fact, any kind of hormone test you choose, whether it's a urine test, a blood test, a saliva test, we want it in the second half if you still cycle. So if you still cycle, we're ideally shooting for after ovulation. And ideally, you want it in the double digits. You want that progesterone at its peak of the mountain to be somewhere between 10 or 20, 25 nanograms per ml. That's ng/ml. So that's what I mean by double digits, above 10. If it's below, if it's in the single digits, like let's say it's 1 or 2, then I know you probably haven't ovulated, or you're not making progesterone like you're used to, or maybe you collected at the wrong part of your cycle, which timing is everything here. As you get older, you may find that your once robust progesterone is dropping down to the single digits. You may be at like a 5 or a 6. So I know you ovulated, but you're not pumping out the widget progesterone out of your factory anymore, not like you used to. You're not as robust. So if you choose to get progesterone testing done, if you're still cycling, you can get some of that insight into progesterone. And if you're perimenopausal and still looking to become pregnant, you want your progesterone to be in the double digits. You want it to be as high as possible, whether your own body is producing it or if your practitioner puts you on progesterone, that's why. Again, it's progestation. It helps smooth things over, make it easier for implantation in the uterus. But if fertility is not your goal, it's still really helpful for all things uterus. Now, if you're listening to this thinking, my cycles are wild, Carrie, they are pure chaos all over the place, how would I know when to test? You're right. You don't have to. You're not required to do a test. I'm just saying if you did test because you did have regular cycles, that's what we're looking for. If you're in the pure chaos mode of like, I've been skipping cycles and then I got 2 periods in a month and then I'm skipping cycles and then I got 2 periods in a month, we just assume your progesterone is not good. And that's probably why your practitioner suggested progesterone. So let's talk about the different forms. Before I do that, I want to talk about progesterone versus progestin. Progestin are synthetic progesterone. So this is like the progestin in a birth control pill, the progestin in an IUD, like a Mirena or a Skyla or Kylena. This is a progestin known as Provera, which is one of the hormone therapies that can be used in perimenopause and menopause. Those are synthetic. What I want to talk about are the actual progesterone, like the progesterone in your body. From a marketing purpose, we often call it bioidentical or body identical. But like progesterone is progesterone, except a lot of research articles, and sometimes practitioners get it wrong. They're saying progesterone, but they mean progestin, or they're saying progestin to encompass everything under the umbrella. That's progesterone or progestin. Sometimes you'll hear it be known as a progestogen, which does include everything, which is wildly confusing. So make sure if progesterone is what you're looking for, like the kind in your body, you double, triple clarify. This is progesterone, correct? Like the kind in my body. That's why we sometimes refer to it as bioidentical. But let's talk about the different forms. The first form is the oral form, like a capsule. And the trademarked registered name is called Prometrium. You get it at your regular pharmacist. So if you've been prescribed Prometrium, it is progesterone. In fact, we call it micronized progesterone or oral micronized progesterone, OMP. Micronized means it's easier to absorb. It's better to absorb. It gets absorbed better into the body, I would say. Now, Prometrium does have a number of binders and fillers, some food dye, and peanut oil. So if you are sensitive to any of those things, be aware. Let your practitioner know, like, hey, remember I have a peanut oil allergy. Can't do that. Then we'll have to go a different route, which I'll talk about in a second. But the two common doses are 100 and 200 milligrams. So if your practitioner said, let's start with 100 milligrams of Prometrium, that is pretty standard. Or let's do 100 and go up to 200 and see how you do. That's pretty common. Progesterone is generally done at night because it's generally calming and relaxing and soothing. So be careful. Talk to your practitioner or the pharmacist. But if it doesn't say on the bottle, usually it's taken at night for that reason. If you still have your uterus and you've been prescribed estrogen, estradiol, which is E2, they're going to give you a progesterone or a progestin, but that's not what I'm talking about, a progesterone. The reason is we're trying to avoid something called hyperplasia, which is when the inside of the uterus can get thick, and we don't want it to get thick because, God forbid, worst case scenario, it can become endometrial cancer, and we don't want that. So progesterone is given at the same time as an estrogen if you still have your uterus. That's to prevent that. And the oral micronized progesterone is a very common form to use. Your practitioner may have you do it every day at night. They may have you do it 2 weeks on, 2 weeks off, depending if you still cycle, you're just not making progesterone very well. Like there's a few ways you can take it. There's not like a standard cookie cutter, everybody gets the same way. It's a little more tailored to you and what you've got going on. Now, if you don't have your uterus, you've had a hysterectomy, but you still have your ovaries, sometimes your practitioner may say you don't need progesterone because you don't have a uterus. But remember what I said in the beginning, progesterone is all through the body, like in the brain. You have progesterone receptors all over. There's still benefit to taking progesterone for the rest of your system. So something to keep in mind if you're struggling with sleep or anxiety or calm and you're looking for all that and you don't have your uterus, that you can say to your practitioner, I know I don't have a uterus, but I'm still struggling with these things and I would like to try oral progesterone. Now, if you can't do peanut oil or binders, the fillers, the food dye, you're like, nope, I'm sensitive to all of that. Then we have to get it compounded. So you hear a lot about compounding pharmacies. So compounding pharmacies are a pharmacy with a pharmacist, but they compound it or make it specifically for you. So the hormone they use is FDA approved. They're going to use progesterone, but the end product, the end widget, is an N of 1, meaning it's just for you. So they're going to make you a progesterone without the peanut oil and without like those binders, or they're not going to add food coloring or food dye inside of it. And let's say you tried 100 milligrams and you didn't like it. You felt like it was too much. Well, prometrium doesn't go lower than that. So compounded, you could do a smaller dose. Let's say you're a sensitive little bunny and you're like, can I start with 25 milligrams or 20 milligrams? You can if it's compounded. So this is the benefit of compounding if you're sensitive to the stuff inside or you're just as sensitive in general and you need to start with smaller doses. That's why we have compounding pharmacies. I will caveat this by saying compounding pharmacies are not FDA approved what they make. So if you need a 25 milligram because you're sensitive and you want to start small, just know that progesterone is progesterone. That part's FDA approved, but your actual bottle of progesterone is not FDA approved. That's different than prometrium is standardized. It is either 100 milligrams or it is either 200 milligrams. So prometrium as a whole is FDA approved. All right. So we've talked about oral forms. Let's talk about vaginal forms. So some women can't take the oral form. They get crazy weird side effects. They don't like it. Or in the fertility space, oftentimes we default or refer to the vaginal form of progesterone. So vaginal form is exactly what you think it is. It's like an insert or a cream, a suppository that is inserted at night so you can still get the progesterone effects. Great for the uterus, potentially great for the body, not as great for the brain and like calming and soothing, but definitely some women feel that with it, but without having to swallow it. So if you are having any side effects with the one you swallow, the vaginal form is probably the form they're going to suggest to you instead of like, hey, insert it at night before bed. And that way it's going to bypass when you swallow it, it goes to your liver and your liver has to break it down, which is fine. But some women find that can bring on some side effects. So you would switch to the vaginal form. And the vaginal form, again, is also okay. Like if you're on estrogen and you have a uterus, the vaginal form is an option also. Now, the vaginal form obviously goes in the vagina. Don't use it as a lubrication. Don't use it for fun times. Make sure you use it after. Make sure you plan accordingly. Your partner probably doesn't need all that extra progesterone if you're inserting that at night. Just be aware of that. So then we have progesterone cream, which is something that's topical. So progesterone cream is interesting because it is not FDA approved. It is, in fact, it's not even monitored because you can get it online. You can get it at your local health food store. You can get progesterone creams all over. Now, progesterone cream is different than wild yam cream. So if you're thinking to yourself, oh, I'm going to do wild yam cream, do know that wild yam cream, years ago, it was thought wild yam cream could turn into progesterone and raise progesterone levels in the body by a particular company. Unfortunately, lawsuits ensued because that's not the case. That's not how wild yam works. And that company was putting progesterone in the cream. So the progesterone was registering in lab tests, making people feel better, but it wasn't from the wild yam. It was from the progesterone they were putting inside. The reason they were doing a wild yam cream for your progesterone was because progesterone can come from wild yam, but it is synthesized in a lab. So to create progesterone out of wild yam, they have to heat it to a really high degree, put it through some chemical reactions, and then it becomes progesterone. And your body doesn't do that. Like your gut and your liver are not going to magically convert wild yam into progesterone. So wild yam cream is not what I'm talking about. I'm talking about actual progesterone cream where there's actual what they call USP progesterone on the label. Now, here's the issue with progesterone cream is that because it's over the counter, who knows where you're getting it from? Be very, very careful if this is the route you're choosing to go or your practitioner is like, just go to the store and get progesterone, cream. So it's kind of wild. And it's dosed. It'll often say things like a fourth a teaspoon is 20 milligrams. So that's up to you to guess, or it'll say a small dab. A small dab is 20 milligrams. And you're like, a dab? My dab? Their dab? Like, how big is a dab? Like, I'm kind of generous. My dabs are big. Somebody else might be concerned and they have like little small dabs. So it's not controlled, and that can be really hard. The other thing about topical progesterone or progesterone cream is that when it's rubbed into the skin, it tends to stay there. Progesterone likes fat tissue. So if you're rubbing it into your thighs, if you're rubbing it into your belly, if you're rubbing it into your breast tissue, unfortunately, it stays there for a lot of women. And that's not what you want. You want it to go out through the system. And it sort of releases erratically. We can't control that just because of the nature of the progesterone hormone. And lastly, if you're on estrogen, progesterone cream is not what we consider approved or guideline approved to protect your uterus from that thickening, that hyperplasia. So we don't use progesterone cream if you're on estrogen 99.999% of the time. Obviously, there are people out there I hear and see that are on progesterone cream and they're on estrogen and they have a uterus. I'm sure it's for a good reason, but that's not what the research has showed. The research has showed it's not actually protective against hyperplasia, and you don't want to get thickening in the endometrium. Now, does progesterone cream work? Anecdotally, absolutely. I have had women that said, I just went to the natural health food store, I got a progesterone cream, or I found one online that I researched, and I do a dab twice a day or at night before bed, and I do notice a difference. Is it placebo? Is it real? I'm not actually sure, but like, if that's all you're doing, if you're finding this is really what's helping mitigate your symptoms and managing your perimenopause, and you're just doing this progesterone cream, like, good on you. Fantastic. Keep going. But if you're looking for something a little more specific, you're looking for something for you, you're looking for something dosed, then we're going to have to go one of the other routes that I mentioned. Now, lastly, and I do think like this is important to mention, there are, again, I mentioned that hyperplasia. And if you're on estrogen, you have a uterus, like you do still have the option of a progestin IUD. That is not progesterone. But I do want to just say that if your practitioner says to you, hey, you have a uterus, I'm going to put you on estrogen, we have to protect the uterus, do an IUD, and you like that idea, that works for you. Let's say you are still trying to prevent getting pregnant. You do not want to get pregnant. You are still fertile. You can totally do an IUD. But I will say the IUD, the progestin in the IUD, doesn't tend to help the calm, the soothe, the anxiety, and the sleep. So if that is a big part of your symptoms, know that the IUD is probably not going to support that. It will reduce significantly the risk of hyperplasia, the thickening in the uterus, but it's not going to help you sleep better, and it's not going to reduce that anxiety. So I have some women that say, well, I do an IUD and then I add an extra progesterone. I do a progesterone capsule. And that is an option as well. You can do progesterone with a progestin IUD. I know it sounds like a lot, but it is an option. I get the question all the time of like, I have an IUD, I don't want to get pregnant, I'm on estrogen, but I can't sleep, and I have terrible anxiety, I don't know what to do. Now, be aware, the progestin IUD can come with some of those side effects. Anxiety can be a side effect of it. I mean, like some of the crazy thing. If you look up the side effects of the progestin IUD, I'm like, just look at a timeline when you had the IUD inserted that line up with some of the side effects that you're experiencing. I just want you to be aware that it's a potential. But if you're like, no, I've had the IUD, these symptoms came on, well after it or like well before it, then that's different. You can talk to your practitioner about progesterone. Whew, that is a lot of information around progesterone. I will lead with this on herbs and progesterone because I get this question. Carrie, I'm perimenopausal. What herbs increase progesterone? Well, none. Not the way you're looking for. There's no herb that tells the ovaries to make progesterone, like do the thing. If you want to raise your progesterone, that's the thing you need, then you have to take progesterone. Are there herbs that can be supportive of your own body potentially making progesterone? Yes, absolutely. And I've talked about that in other episodes. The one you hear probably the most about is called chaste tree or Vitex. And Vitex, by and large, we think helps to lower a hormone called prolactin. Because if prolactin is a little bit high due to stress or thyroid issues or dopamine issues, then it can throw off your cycle and reduce progesterone. So if you use chaste tree and it drops your prolactin back in the normal range, then the communication improves, you ovulate again and get your cycle back. I've also seen information about chaste tree and how it seems to be an adaptogen for the ovaries, that it can just sort of help balance, and by balance I mean like get things back on track the way they're supposed to. So I like chaste tree a lot, but I know it's not a magic pill for everyone. And if you are deep in the throes of perimenopause, I don't see it work. At that point, this like the cells and the communication, the mitochondria, like we need to do other things besides just chaste tree. There are other supports, like you'll hear of evening primrose oil. You'll hear of a root or tuber called maca, M-A-C-A, maca, and they can be supportive to the body as well. You will hear of like things to support stress. Anything you do, whether it's herbal or nutrient or nervous system work to help get your stress in check, get you more resilient, bring everything down, those things could indirectly support your hormone production, including ovulation. Because remember, if you are a 10 out of 10 stressed out mess, it's possible the brain goes, it's not safe right now to become pregnant, whether that's your goal or not. Therefore, I'm not going to ovulate and I'm not going to make progesterone. So I've absolutely had people say, I did everything I could over the last 3 months to get my stress in check, which could include taking stress-based, herbs for stress, nutrients for stress, saying no, setting boundaries, talking to a therapist, all the things. And they're like, and my cycle went back to normal. And I'm like, great, fantastic. But if you are thinking, I need progesterone, like I just want progesterone, then that requires taking progesterone. So there's a lot of ways to approach it, but it does depend on like what's your age and what's going on. Where are you in perimenopause? Do you have a regular cycle? Are you irregular? Have you been skipping months already? Like I have all these questions, and that sort of tells me about your progesterone. But since the point of today is straight up progesterone, that's what we talked about. I just had to end on a few of those other like little keynote pearls for you. I hope this was helpful. If you have questions about progesterone, if you are on progesterone and curious about the way you're taking it or the dose you're taking, obviously always talk to your practitioner, but ask in the comments, because these are the types of conversations that I want to have and help you feel educated around. Because I know hormones like progesterone and trying to chase that down can feel like herding cats, and I am here to help.